Attention Deficit Hyperactive Disorder, ADHD, by Bjones, Pueblo Community College. Attention Deficit Hyperactive Disorder, ADHD, is a chronic neurodevelopmental disorder characterized by developmentally inappropriate levels of inattention, impulsivity, and hyperactivity. The Diagnostic and Statistical Manual, 5th edition, DSM 5, classification system lists 3 presentations of ADHD: predominantly inattentive, hyperactive impulsive, and combined, which presents with symptoms of both of the other presentations. The characteristics of inattentive classification are: fails to give close attention to detail or makes careless mistakes, has difficulty sustaining attention, does not appear to listen, struggles to follow through with instructions, has difficulty with organization, avoids or dislikes tasks requiring sustained mental effort, loses things, is easily distracted, is forgetful in daily activities. Characteristics of the hyperactive classification of attention deficit hyperactive disorder are: fidgets with hands or feet or squirms in chair, has difficulty remaining seated, runs about or climbs excessively, difficulty engaging in activities quietly, acts as if driven by a motor, talks excessively, blurts out answers before questions have been completed, and has difficulty waiting or taking turns, interrupts or intrudes upon others. ADHD affects 11% of school-aged children. It is diagnosed 3 times more frequently in boys than in girls. It is also more prevalent in developed countries due to the financial means to get diagnosis and treatment. Approximately 30 to 50% of children with ADHD will repeat a grade level at least once. The cost of raising a child with ADHD is nearly twice that of a child without ADHD due to medical bills and special services. The exact cause of ADHD is not known, but there are 3 factors that are believed to play a part in the development of the disorder. The first is hereditary. It has the most scientific backing. If one parent has ADHD, there is a 50% chance that the child will have ADHD. There are also 2 genes associated with attention deficit hyperactive disorder. One is the D4RD, which is related to the personality dimension known as novelty seeking. The other is the DAT1, which aids in the regulation of dopamine. Another area that is believed to cause ADHD is brain development and function. The part of the brain that seems to be affected by ADHD is the frontal orbital region, and it leads to deficits in catecholamines, dopamine, and norepinephrine. It is also believed that the dopamine levels present in the brains of children with ADHD differ from those who do not have ADHD. This is believed to be due to disturbances with dopamine signaling systems. A child must present with 6 or more of the indications of ADHD to be diagnosed with the disorder. Several of these symptoms must have been present before the child is of the age of 12. It is usually diagnosed by clinical psychologists, physicians, or clinical social workers. A thorough, comprehensive evaluation must be completed for a proper diagnosis of ADHD. Below is a list of assessments that should be completed prior to diagnosis of attention deficit hyperactive disorder. This list can also be found on CHAD, the National Resource for Attention Deficit Hyperactive Disorder. The treatment of ADHD is multimodal and may include medication, psychological counseling, behavioral treatment, and educational intervention. Medications that can be used for treating ADHD include psychostimulants, antidepressants, antihypertensives, and amoxicillin. Psychostimulants are Schedule II drugs. They have a high rate of abuse. Psychostimulants increase blood pressure, heart rate, constrict blood vessels, and open pathways of the respiratory system. A general warning for stimulants is they have caused stroke, heart attack, and sudden death in people with high blood pressure, heart disease, or a heart defect. Stimulants are contraindicated in patients who have glaucoma, hyperthyroidism, severe agitation, or a history of substance abuse. Stimulants should not be taken within 14 days of monoamine oxidase inhibitor drugs, as severe drug interactions can occur. There are many antidepressants that can be used in the treatments of ADHD, including tricyclic antidepressants, Wellbutrin, and MAO inhibitors. Many of their side effects include stomach upset, effects in sleeping, and xerostomia. Most importantly, the Food and Drug Administration has determined that antidepressant medicines increase the risk of suicidal thinking and behavior in children and adolescents with depression and other psychiatric disorders. Antihypertensives are especially useful in treating children who have repetitive muscle movement or significant problems controlling their impulses and aggression. They are often used in conjunction with a stimulant medication. Common side effects of antihypertensives include sleepiness, lightheadedness, and headaches. Strattera is considered to be less effective than psychostimulant medications. However, it is not a controlled substance, therefore people are less likely to abuse it. Side effects include significant abdominal pain, nausea, and drowsiness. There are other side effects experienced by children and adolescents more often. They include upset stomach, decreased appetite, nausea, dizziness, fatigue, mood swings, drowsiness, and abdominal pain. When taking this medication, liver function should be monitored as well as heart rates. There are common oral complications that exist with all of these medications previously discussed. The three most common are xerostomia, or dry mouth, dysgeusia, altered taste, and bruxism, which is grinding or clenching during sleep. Antidepressants also have other oral side effects. which include stomatitis, gingivitis, glossitis, sialadenitis, dysphagia, discolored tongue, and oral edema. Due to concerns with the safety of medications used to treat ADHD, there has been an increased interest in natural treatments for ADHD. Some complementary and alternative medicine treatments that have been studied include elimination diets, which involves removing food additives such as color and perhaps preservatives. Also, neurofeedback, which involves retraining brainwave patterns using operant conditioning. Yoga, which uses physical postures, breathing exercises, and meditation, has been shown to improve severe physiological functions and improve cognitive domains such as executive function, attention, intelligence, memory, and concentration, and has been used to help children with ADHD. There are many natural product-derived ADHD treatments that have been investigated, including botanical or herbal medicines, vitamins and minerals, and amino acids. In most cases, these supplements are investigated versus methylphenidate taking ADHD children. Below are some botanical agents that have been investigated in the treatment of attention deficit hyperactive disorder. Many of them reduce the symptoms of ADHD. However, most seem to be less effective than methylphenidate. The following is a chart which looks at several vitamins and minerals that have been studied in the treatment of attention deficit hyperactive disorder. The use of amino acid therapy in the treatment of ADHD is controversial. Some studies indicate a reduction in hyperactivity and inattention, while others report no significant benefits when compared with placebo subjects. Psychosocial treatment is a critical part of treatment for attention deficit hyperactivity disorder in children and adolescents. These treatments help children deal with difficulties that arise due to hyperactive, inattentive, and impulsive behaviors that are the symptoms of ADHD. They help children to adapt in school, social situations, and personal relationships. This sort of treatment also helps parents and children deal with the condition. According to the National Resource Center on ADHD, CHAD, there are 5 key components of behavioral modification that are recommended. These include: start with goals that the child can achieve in small steps. Be consistent across different times of days, different settings, and with different people. Provide consequences immediately following a behavior. Implement behavioral interventions over the long haul, not just for a few months. Teaching and learning new skills take time, and children's improvement will be gradual. When it comes to making it through a dental appointment with a child with ADHD, here are some tips that you should take into consideration. Number 1, plan ahead. Make sure that the patient has taken his or her medication. Upon greeting the patient, shake their hand. Do not walk into the treatment area and cattle call the patient. Get down on the patient's level. Make sure that you smile. When communicating with the patient, use clear, concise words. Be direct. Speak in a neutral tone. When it comes to dental appointments, mornings are usually best. Make the appointment short and be sure that your doctor is ready to come do the patient's exam so that they do not have to wait in your room. There are a couple of techniques recommended by Lisa Mayo, a dental hygienist who has extensive experience in dealing with patients who have ADHD. The first is to use I wonder questions. Rather than asking the patient if they brush or if they floss, use questions such as, I wonder what happens to teeth when you don't floss them. A second technique that she has found very effective is the use of free response tokens. In this treatment, you will give the patient 5 tokens or pennies and explain what is expected of the patient. Things you want them to do, things you don't want them to do. Anytime there is poor behavior, you will silently remove a token. You will explain to the patient that if a token remains at the end of the appointment, they get a prize. Attention deficit hyperactive disorder is a complex disorder which involves many modes of treatment and behaviors which should be considered by the dental professional. I hope that you feel more prepared to deal with ADHD patients in your practice and more knowledgeable about the different treatments that are available for this disorder.